Cambridge University Hospitals, sitting right at the heart of the world-class Cambridge Biomedical campus, provides a unique opportunity to undertake research into COVID-19. In recent weeks, we have seen a remarkable collaborative effort between clinicians, research and support staff that has allowed our patients to participate in many research programs. Remarkable progress has already been made. We were the first UK hospital to test the Samba point of care test for COVID. Developed originally as a point of care test for HIV in Africa, the machine has been adapted, and we have been able to, through research, show that it can be used as a very rapid diagnostic test for COVID-19 that is now being rolled out into clinical service through our point of care testing team. The test allows patients to be triaged so that they can very quickly enter the right environment and receive the right treatment. Working together with scientists in the Jeffrey Cheer Building and Occupational Health, we've been able to establish a healthcare worker screening program. In the early days, we found that 3% of healthcare workers who were asymptomatic or only mildly symptomatic carried the virus. We've been able to sequence the whole genome of those viruses to show how it is changing and how it is transmitted. More recent results show that the infection amongst healthcare workers has reduced dramatically. Only 2 of over 1,000 healthcare workers screened have recently tested positive. The COVID-19 cohort of the Cambridge-led NIHR bioresource allows patients and staff to contribute to the research effort and help us better understand the COVID infection. By providing information about themselves and biosamples, we can determine why some patients seem to have only mild symptoms, whilst others can get severe disease leading to organ failure and in some cases ultimately death. Alongside these studies, we've been participating in national clinical trials to develop treatments for COVID and also Cambridge-led trials. An example of these is the study TACTIC, which is using drugs that have been developed to treat inflammatory diseases to see if they can improve the outcome in patients with COVID. When people get an infection with COVID, there's a fine balance between the immune response, fighting the infection, and the damage that that can do to the patient's own organs. By using drugs that dampen that immune response, we hope that in some patients we'll be able to prevent the severe organ damage and fatality that can accompany the disease. It has been a remarkable achievement over such a short period of time, and I really want to thank all of the staff that have contributed to this research effort.